Good morning. All people are unique and culturally autonomous, and consequently not one system of healthcare or one way of giving birth should be standardized and applied to everyone. Each of us deserves the right to options, and this is true for women and their sexual and reproductive healthcare and birth experience. A woman's values, beliefs, and cultural identity should inform the choices she makes and the options she has. Her identity and culture should not be sterilized out of medicine and healthcare, but rather integrated and embraced. I came to this realization while observing in labor and delivery in a local public hospital in Cochabamba, Bolivia. On many occasions, I observed culturally insensitive and inappropriate care that seemed to be the standard. A particular experience had a lasting impact and truly forced me to question and reflect on the current system and the interrelated nature of health and society. A woman in labor arrived to the sterile delivery area in a wheelchair, fully dilated to 10 centimeters and in the pushing stage of labor. One medical student was given the opportunity to practice and attend the woman. When she did a vaginal exam to check the woman's dilation, she did not feel the baby's head, but rather the feet, indicating that the baby was transverse, and this required an emergency C-section. The resident held her hand in the woman's vagina in order to stop her from pushing and the baby descending any further. She was rushed to the surgery room next door, and the supervising gynecologist was paged. The woman was quickly given anesthesia as the interns tried to find the baby's heartbeat with a portable monitor. They were continuing to have trouble locating the heartbeat when the gynecologist arrived. She came in very angry and stressed and proceeded to yell at the woman. "No escuchamos el corazón. Es posible que esté muerta. Si está muerta, es tu culpa. Es tu culpa que no viniste antes. Es tu culpa si la guagua nace y está muerta." Translated, we cannot hear your baby's heart. It's possible that it's dead. And if it is, it's your fault. It's your fault because you did not come earlier. And it's your fault if your baby is born and it's dead. She kept repeating this as she started the surgery very hurriedly. The operation was a bit complicated. She struggled to get the baby out of the uterus, and there was a lot of pulling and pushing and bloody mess. But when she did manage to get the baby out, it cried right away, and luckily was very much alive. The baby was immediately handed to the nurse standing by and was taken to the nursery down the hall to be examined for any lasting issues. The mother was sewn up and then taken to recovery, where the baby eventually met her for the first time. Why did this woman end up having the birth experience she did, and who or what is responsible for a very risky and traumatic birth? It is crystal clear to me that this happened because of a lack of appropriate medical care. There are varying factors determining why women and their children do not receive adequate medical care in Bolivia, specifically newborns and women during and after their pregnancy. Each woman's situation is unique, but there are several common causes. Many women do not receive prenatal care in clinics or give birth in the hospital at all because of cultural insensitivity, maltreatment, and unfriendly and uncaring medical professionals. They would rather give birth in their home with their family members present or a midwife from their community, where they can practice traditional rituals if they choose. Some women are unable to access health services because they live in very remote areas where services do not exist, and they do not have the economic means to reach these services. Other women use the services, but then they have a traumatic experience or they're not treated well, and then they stop in order to avoid further maltreatment. Discrimination is also a factor that either implicitly or explicitly affects the care that patients receive. Also, many women are uninformed about their options or that health services even exist. After my observation in public clinics and hospitals, I was motivated to look for alternatives to this culturally insensitive system of care and see if there were any meaningful changes being implemented. I found this hope in a new university program that is educating obstetric nurses in Tarija, Bolivia. I researched public health policies and conducted participant observation and interviews with students, professors, and nurses, and this has shaped my conclusions. The program is unique in that it focuses on providing a form of care that is intercultural, holistic, respectful, and sensitive. The fundamental idea of the program is that in order to reduce infant and maternal mortality rates in Bolivia, it is essential to provide health services with knowledgeable and trained professionals in rural communities where they are most needed. But these professionals must also understand and apply the ideas of intercultural health and cultural sensitivity in order to connect with the community and gain their trust, and thus provide the best care possible. The obstetric nurses in this program are educated about both traditional medicine and biomedicine and learn how important traditional medicine is to many citizens in the communities where they will work. These students and professors shared their passions with me and embody the changes that I have come to see as necessary within the healthcare system in Bolivia. They shared their values and ideas about how to treat patients with compassion and how to implement intercultural health. And they provided satisfying solutions and answers to all of my questions. From talking to the students, professors, and nurses, I saw the human form and active embodiment of the initiatives, policies, and ideals that I had researched and yearned for. These medical professionals are inspired and innovative, and they genuinely want to serve their community and country in a way that ignites actual change. They not only see the importance of intercultural health and the integration of traditional medicine with biomedicine, but they are also learning and practicing their application. They realize the desperate need for caring, motivated, and open-minded professionals to serve in all communities, but especially in rural areas with poorer Indigenous women, and they are ready to act. As one professor said to me in an interview, his name is Henry Sanchez, he said, "Always at the beginning of any strategic union, there are problems. There are always people who resist, professionals who resist, and there's always resistance and rejection. I believe traditional medicine and biomedicine can and must coexist. They must, because not everything is known or understood in either one, so the two can complement each other in a way to come out ahead, which is the final goal. Not for traditional medicine or biomedicine to prevail, but rather the health of the population." Thank you.